Hi, this is Steven, a few weeks out from a total hip replacement. How's it doing, man?
Boy, it's doing fantastic. I just can't believe, how well it's coming along. All these years feared doing it and wish I would have done it sooner now. And all the pain I used to have, totally gone.
Can you take a couple of steps? All right, which hip did we do?
The right?
There you go. You can't tell to watch you walk.
I was fearful myself. That's why I put it off for so many years, and now I just regret it so much. But thanks to you and your team, did a great job. I just can't thank you enough.
Well, I've got an awesome team, and you are very welcome. So thank you.
Thank you.
We'll see you take a couple of steps.
Actually, you couldn't have several months ago, but yes, I can walk now without assistance.
Terrific.
I can stand. Which has been great.
So it's made a difference for you?
It has made life changes for me. I'm actually able to do things with my grandchildren. Just getting up and getting dressed in the mornings, taking a shower and getting dressed exhausted me. And now I can get up and get dressed and go all day long. We actually took a trip to Disney World and Universal Studios, and I was able to walk and enjoy the visit with my children and grandchildren.
Good morning, this is Carol. She is about 6 weeks now post-op from a robotic total hip arthroplasty. Doing okay with that?
I'm doing great. Much better. I came out of it stronger than I did with my first one. And it was just, the recovery seemed like so much faster. I was able to get out of my chair on my own, get out of the bed on my own, without any help at all. I was able to walk in my shower, do everything that I did before I had my surgery as soon as I got home.
That's awesome. And you're speaking of having a conventional hip replacement on the other side and then a robotic assisted on this left side more
right,
recently.
My first one was the conventional. It was 7 years ago, and compared this one to my first one, the recovery time was just so much faster and better. Everything was better.
All right, we're here with Deborah, and 2017 was a pretty big year for you. You actually had both hips replaced.
I did. And I do not regret it. I would do it all over again. I suffered with that for 4 years, and I just would not give up to have anything done. Whenever I came in to see Dr. Barber, I probably could not even walk to the store. And whenever I had my right hip taken care of, the very first, whenever I woke up and they had me get out of bed, I had no pain whatsoever. So after I had that one done, my left hip started to bother me. And I came into the office and had that done in July. And now I can walk and play with my grandson. And this Christmas, I actually cooked Christmas dinner. Last year, I could not do it again. I've taken a lot of pain pills for the pain that I had. Now I take none. And I would tell anybody, just don't be afraid, have it done, and your life will change.
Can you take a couple of
I
steps?
can do that.
No cane or anything,
No
just
cane.
getting up out of the chair, no problem, and going.
And I was walking without a cane in 2 weeks, and I never used a cane, but after 2 weeks I had no walker.
Awesome.
So I can climb stairs now without even holding the rail. So it's great. I feel great.
All right, Brenda is a few weeks out now from a hip replacement on which side?
Left side.
How's it doing?
Great.
Can you walk around a little bit with
Oh,
it?
yes.
And how are you versus before surgery?
Oh, I'm doing good.
Doing awesome. That
Yes.
looks really good. You had a Mako robotic total hip replacement. And looking at your x-rays here, that allows us to be just super precise with how we place the implants. So we've got great positioning The leg lengths and the offset of the hip are correct. A fabulous result with that. And you worked hard.
Yes.
And got a fabulous
Yes, I
outcome. All right, we're here with Mr. Prince now, almost 2 months out.
2 months out.
Robotic hip replacement on which side?
Left side, left hip.
And can you take a couple steps? I saw you just cruising in here like nothing had happened and looking great already.
It's been a wonderful experience, you know, especially having something to get back to, a life to get back to. And I've been telling a lot of people, I really didn't look at the surgery. I looked beyond it. I looked at the life that I would have after it was done. Because, in fact, before I had the surgery, the only thing I saw was obstacles in my way. But I knew that the surgery was going to allow me to actually get back to the life that I wanted. People have just been shocked because they are looking for me to walk different or, in fact, walk with a limp, and I haven't. So.
That's awesome.
Yeah.
And your case is one where I think there's tremendous value in what we're doing with the robotic assisted hip replacement,
Right.
because at your age, I need this to be 100% right.
Yes.
I want those implants positioned exactly right,
Right.
because we know it's got to go a long, long time, and we know we want to maximize the chance of that doing great for as long as possible. So
Right.
thanks for sharing that. I think you're going to help a lot of people out with that.
Well, in fact, you're welcome. And if you're thinking about doing it, don't think about it, get it done.